So we know it has been a long day. We have another stretch to go. So we propose to start.
Clapping the hands clearly worked.
Yeah. May I invite you to, as we are in less in number, to get nearer so that we can have a better interaction during this panel. That would be good. Oh, people are coming. Okay.
Maybe you need to clap for that one too.
Huh?
Maybe you should clap for that one also.
Shall I? In front of the mic? No, it's not good.
We're all sitting in the back. I think we can just start.
Okay, let me start. Good afternoon, everybody. My name is Carlo Carugi. You can see here, I'm not from the health community. I work at the GEF Independent Evaluation Office. The Global Environment Facility is the institution that has been created as a result of the conventions on environment that were held 20 years ago in Rio, and the GEF is the financial mechanism for these conventions, for the countries that have signed these conventions to, let's say, get financial support to comply with the obligations that they have signed in these conventions. I was kind of surprised to be invited because it's not my sector, although I'm an evaluator, and I don't know much on the challenges that are faced by the people who are busy dealing with evaluation in the health sector. So I try, with my limited understanding and knowledge of the sector, to imagine what might be the challenges that or the differences or the similarities in the challenges that we have in the environment sector as compared with the health sector. And I can see, and I repeat, it's my limited understanding, so please challenge me, contradict me. I might have it wrong completely. But I'm impressed by the amount and the quality of your data sets. You have huge amounts of data. And we don't have this luxury in the environment sector, especially when we go at country level. I lead the country portfolio evaluations team in the evaluation office, so we deal with country portfolio evaluations where that's the level I'm talking about. So that's the first difference. The second difference is the time horizons for outcomes, certainly to materialize, and eventually also for impact. In the environment sector, impacts are quite complex to be measured, and they take a long period, long time horizon to be observable. I imagine, but I might have it wrong, that this is not exactly the same in the health sector. But I also identified areas where there are similarities. For example, we both face the challenge on how to evaluate capacity development, because also in the GEF we do capacity development initiative. The challenges of evaluating dissemination, awareness creation, or challenges in evaluating the effectiveness and efficiency of support in the creation of the legal and policy enabling environments for our efforts to get to outcomes and impact achievement. So I look forward to hear and to learn from you whether I got it wrong or whether some interesting discussion can come out from this initial consideration I'm giving. My role here is to, I've been asked to moderate a session on mixed methods evaluation on triangulation by bringing in the experience of the GEF Evaluation Office in the use of mixed method evaluation and triangulation. In the GEF Evaluation Office, we do it in country portfolio evaluations to identify findings. And we do it because we live in a situation of scarcity and unreliability of data. So I have a presentation, so let me move there to give it to you, and then we continue. quick overview of what I'm going to say. I'm going to give quickly. This is a very well-informed audience, so I don't need to give lots of definitions. Everybody knows what is triangulation, what do we intend with, but anyway, it's a starting point. And then I will describe what are the common challenges that we face when we do country portfolio evaluations and how we address them. And then I will describe the systematic triangulation procedures that we apply, which is one of the main ways in which we address those challenges. And then we have some work in progress on, we want to learn from lessons. We applied this method in 9 evaluations so far, so we are trying to draw the lessons from there, and so there is some work in progress on how effective this method has been in its main goal of identifying evaluation findings, which I will present to you. And then I'll give a quick example from an evaluation that we conducted in the Pacific region. So, quickly said, triangulation, refers to the use of multiple sources of qualitative and quantitative information, data collection and analysis methods. In research, it is usually done either to validate the results in a study or to deepen and widening one's understanding and insights into the study results. There are several articles out there in the literature that describe ways to do this in several fields. But the literature describes also criticisms to the use of triangulation. The most important one is, for example, the criticism, the one that comes out from the discussion on interdisciplinary research. This discussion basically says that triangulation frameworks have to be ad hoc because there is not a theoretical empirical justification for it. Scientific research is by definition empirical and disciplinary, and therefore it's difficult to see where triangulation can fit in. Very quickly and concisely, authors can caution on the use of triangulation as a method, and they advocate for the development of standardized protocols, procedures, and methodologies when it comes to triangulation. And that's where our experience at the GF Evaluation Office can contribute to the discussion, because we do our evaluations at country level in a standardized way, and this is a best situation to apply a triangulation procedure that is systematic and it can be repeated in a sense. So basically, in evaluation, we do methodological triangulation most commonly, and especially in the absence of scarcity of data, as I said. In our country portfolio evaluations, we use it in conjunction with investigators triangulation. So we do it basically in an internal way within the evaluation team at the end of the evaluative phase. I will describe this later. We think we basically observed that this procedure has helped us in reducing the risk in which evaluators, of course, of using anecdotes too much, giving too much importance to anecdotal evidence, while because they basically moderate each other in the brainstorming session. And also the risk of giving excessive importance to the finding of one specific method as compared to the findings of the other. So it helps to prioritize the importance of method-specific results and findings. And we think it is a very useful thing. So what are the common challenges that we face? Basically, country portfolio evaluations are studies that look back since the beginning of the GEF support in a given country, all along let's say 20 years of operation. So they're quite ambitious in terms of time frame, and that's for the only reason that I was saying before. Impacts to be observable in the environment sector, that takes a lot of time. And also the GEF hasn't been, the first phases of the GEF in the early 90s haven't been very efficient. Therefore, we have to look at this time frame. And we face these common challenges. Absence of country program objectives and indicators to which to hook the evaluation. The GEF is a facility, is a financial mechanism to which agencies apply for project support, project level support. So only recently, let's say 4 or 5 years ago, the issue of country programming, the idea of country programming for use of GEF's resources in a country has been introduced. But again, as we look back 20 years, we can't use those country program documents to hook our country portfolio evaluation to. We have problems of scarcity and unreliability of national statistics or environmental indicators. We have weak and unreliable monitoring and evaluation systems for the projects that compose the portfolio. And we have challenges in evaluating the impacts and establish attribution to GEF funding. And we also have another difficulty deriving from the fact that the GEF is a partnership institution, which is a good thing because the environment is a responsibility of many parties, public and private, the donors community as well as the recipient countries. But this being said, when it comes to data, when it comes to management information system, and the GEF has one major management information system, a central hub, that has to be fed by different agencies and entities which don't have a legal accountability toward the GEF, that's a big problem. So this is one of the things we face in terms of difficulty. So how do we address those challenges? We adopt an iterative and inclusive approach with stakeholders using the evaluation process to help identify and address information and data gaps. And this, at country level, is essential in our opinion. And that's why I asked this question this morning on stakeholder consultation. We conduct original evaluative research during the evaluation, during the country portfolio evaluation, because we don't have enough data, so we need to gather them, especially on assessing progress toward impact. And we use qualitative methods and we mix with the emerging evidence with available quantitative data through systematic triangulation with the ultimate goal of identifying evaluation findings, as I said. So, let me describe quickly our triangulation procedure. So, as I said earlier, the CPEs are standard. We have standard terms of reference with a set of questions that have to be asked in every country portfolio we analyze. And we go to countries to scope the evaluation, to finalize the portfolio information, and to meet and consult with the stakeholders on what are the issues, country specific, that are very important to be looked at in the evaluation. So the terms of reference become country specific. And we build an evaluation matrix. And we use a standard set of gathering methods and tools, including the standard methods that everybody knows, desk review, portfolio analysis, key informant interviews, focus groups, and so on. But we also have GEF-specific methods, which we devised to analyze GEF projects. For example, the way we look at the country environmental legal framework in a country, how it has been formed in time, and whether the GEF has given support, given effective support to it or not. And the review of outcomes to impact, which is a theory-based approach to look in the project progress from outcomes to impact. So, as I said, we have an evaluation matrix at the beginning, key evaluation questions in the first column, divided by the big three main criteria: relevance, efficiency, and effectiveness. We have indicators, the sources of information, and the methodology components which we use to those sources of information to build these indicators to answer the question. I have seen an evaluation matrix this morning in a presentation, and I was interested because it is very similar to the triangulation matrix that we have, and which for us is a derivation from the evaluation matrix. Basically the same first column, but then you have methods in the column, which like the matrix I've seen this morning, which is populated by the factual evidence after the evaluation phase has been executed according to the evaluation matrix, which is our analysis plan. So what do? We categorize the evaluative evidence in three major research areas: perceptions, validation, and documentation. Perceptions, basically individual interviews and surveys, very important. Although perception not necessarily reflect reality, people acts based on perceptions. So we have to take this into account somehow. We have the second research area of validation, which is direct field observation, which might be group consultations like focus groups because it helps triangulate with perceptions, or any kind of quantitative data sets that we have. And then we have documentation, the third research area, which is important because when it's written, it's official. Okay, so that's the way we categorize it. So here is our triangulation matrix with a little bit more explanation. You have the key question, you have the findings, method-specific findings that are identified. In some cases, like in the first red, the F4, you manage to have only one finding, which is not enough. You need further analysis. In other cases, you might have more than one finding from more than one method that speak to the same question, and you are able to identify the key preliminary finding of the evaluation. In some other cases, you have contradictory evidence coming, for example, from two sets of interviews, field level and national level, or two methods. Document review says different things from what it said during a group consultation, for example. So basically what we do is to brainstorm question by question to populate the matrix and discuss about what are the real findings that we have and what is the need for further analysis that we need to do. And you can see the second matrix here, a little bit more advanced in the process, whereby you see the source of information and the method that need to be under the method in question, that is to be filled up to try to get to the findings that we don't have. So as a matter of fact, after the triangulation brainstorming meeting, we have the further analysis. So we go back to the drawing board and we try to confirm or challenge the key preliminary evaluation finding that we are already strong and we try to identify, and identify what else can we do for the missing key preliminary evaluation findings. As I said, we do it at the end of evaluation phase. Well, the time is always a problem. The deadlines are a nasty reality for many of us. And we try to get at least at 80% of the evaluation phase completed in terms of data gathering and analysis. We don't do it. If we don't get to that stage, we actually try to modify the timeline, which is not easy, but that's the minimum threshold in our experience to get to a productive triangulation brainstorming meeting within the team. So, and that's what we have done so far. We've done on 9 evaluations, 8 country evaluation and one evaluation of the small grants program, which is a global program. Maybe that's the most similar evaluation we have in our cohort of what you do. And we have an average of 19 key questions per evaluation. 16 are the standard one, and 3 are usually country-specific. There might be variations in these numbers, but this is more or less the magnitude. So after the 2 days the triangulation brainstorming session, key findings have been generated in 86% of the key questions. 58% were viable, which we thought strong enough to be brought into the report at the final stakeholder workshop, and 28% were non-viable. So we could identify a finding, but either there was insufficient evidence or contradictory evidence or both. In 14% of the cases, we had no key finding. So, what happens? So that's basically the situation where we are at the end of triangulation. What happens is that we do further data gathering for the 48%, which is 28 plus 14. And we have managed in those 9 evaluations to resolve 35% of those cases. In those cases, and we had another 7% unresolved. So those cases add to the 58% and contribute to the AM findings. What is the AM? It's the aide-memoire. It's a short position paper that, after one-page summary on the basics of the evaluation and the methodology, gets directly to the key preliminary findings in response to the evaluation questions. And it's a document which is produced only for discussion at the final stakeholder workshop, where we present it and discuss it with stakeholders to verify whether there are gaps in information, whether there are inconsistencies in the analysis, whatever, and also to validate the findings, to do, okay, what do we do with it? And that's where we basically come up with the 7% unresolved questions. So as you can see, the triangulation is a process. It's an iterative process, and that's how it goes. This is the experience. In the Vanuatu's prep evaluation, we had a matrix with 14 key preliminary findings against 15 evaluation questions. The 14 findings were consolidated in 11 findings through vertical triangulation. I think this is important. When 2 questions speak to the same issue, one from the perspective of relevance and the other one from the perspective of effectiveness, we tend to consolidate this in a finding where they speak to the same finding. And here you have other data on how many findings were generated. One of the findings in efficiency on coordination and synergy showed contradictory evidence essentially coming from different sets of interviews. So we used it for the workshop for further data gathering. Okay, I would like to stop here. I have questions that I would like to pose, but I prefer to wait for my questions for the other panelists to present their experience and see, maybe hear from them their reaction on what we do. So we have Catherine Goodman, Jonathan Simon, Sangeeta Moheri, and Bridget Kelly. I think all of them have been, all but Bridget have been presented. Bridget is the lady who brought me here, who made me, put me in this trouble. So, so not only she said, come and talk about what you do, also she added, you moderate the session. Wow. Okay, so that's what I'm trying to do. So I hand over to Katerina for her presentation, then we come back with some questions. Thank you very much.
Great, well, thanks very much. So I'm going to talk about the use of mixed methods within the AMFM evaluation. You were talking about different roles for triangulation, and I think you were talking particularly here about validation, your first one, whereas I think what I'm going to talk about is more your second one, trying to deepen and widen your understanding of your results. Have I got a presentation?
They're working on it.
They're working on it. What did it say? So I think I was going to begin by just reminding you of the components of our evaluation. It was a before and after study, so we didn't have control areas, and we had those outlet surveys at baseline and endline, and then household survey data for some of the countries. And then what we had was this documentation of process and context. Here we go. Yes. And that's what I really want to talk to you about today, which is how this documentation of process and context fed into our understanding of our evaluation results. So we had a theory of change for the evaluation to try and show what we thought might affect the key outcomes. I think this was something we developed a few years ago. I see many that are so much more easier to read these days than I think our conflicting arrows are. So I think if we were doing something different, we could probably improve on our presentation here. But broadly, what this is showing is in blue, we have those key outcomes, the objectives of the MFM evaluation in the blue rectangles. And then in the green circles, we've got the supporting interventions. So as well as the subsidized drugs going in, we've got the other supporting interventions like communications and training. And then in red, we brainstormed about potential contextual factors that could also have influenced the outcomes, and which we wanted to look at as well to understand the full causal chain. So we drew on this theory of change to target collection of quantitative and qualitative data, both on the process of implementing AMFM and on those other contextual factors. And this was to help us interpret our survey results and to really interrogate the plausibility of attribution to AMFM. So this is how we did it. I don't think any of this will be particularly surprising to those who are involved in studying complex interventions. We had a sort of, called it a case study in each country, collected the data around the end of our endline outlet survey data collection, and it was primarily based on key informant interviews in the countries with public and private sector actors, and also document review of a range of relevant documents. We also drew on some of our outlet survey data itself, because we had some outcomes there that were more related to process in terms of coverage of training or exposure to communications messages. And then we did a sort of standard analysis with a coding framework within each pilot, and then a synthesis across the pilots. And these data really became very central to us when we were writing the report. So we presented we have stacks and stacks of tables in the report, but at the end we wrote a kind of synthesis for each country to try and understand what we saw. And we used these data in a number of ways. One way we used it was just to get some fairly crude measures of implementation strength, just to get a feel of which countries had implemented to what degree. And I've just shown here some examples of the measures we used of implementation strength, as the doses delivered per capita, the timing, so the months of arrival of the drugs till the endline survey, and the months of IEC, BCC implementation till the endline survey. And we had other indicators as well. It's hard to ever find one indicator that really captures what you want, so you need a bit of a range. But we did find a pattern across this, and I've sort of color graded the countries here, and you can see that Ghana and Kenya had the most intense implementation, and Madagascar and Niger the least. So that was quite helpful, just to get a crude picture to help shape our understanding. Then we used the results to help us understand the results in each country. So what I've got here is the results for Madagascar. On the left-hand side, I've got the quantitative results, and I won't go into it in any depth, but it's basically showing Madagascar's performance against those success metrics for availability, price, use, and market share. I've picked Madagascar here because it was a country with some of not the best results, some of the weaker results within AMFM, and you can see that only one of those boxes is green, so they only clearly met one success metric. But then we would look at that directly with our data from the case studies on process and context. So some of the reasons, for instance, that we found for the weaker performance in Madagascar, there were low orders to start with. It was also related to low confidence of importers in actually going ahead and ordering, which is partly related to the context I'll come on to. There was very limited IEC, which was terminated very early on. Actually, it was deemed to be inappropriate, and as a type of the regulatory authorities felt it was direct-to-consumer advertising and shouldn't be allowed. So there was a problem there, and the IEC was stopped. And then in terms of context, they already did have some subsidized ACT program before we arrived. So there wasn't really a clean baseline. They already had some activities in this area before AMFM was implemented. They had major political and economic problems at this time, as I expect you'll remember, with the coup d'etat. And they also have a market structure that's very dominated by outlets on the very informal end of the spectrum. So this is really helpful for us in understanding what was going on in Madagascar. it has its limits. I'm not sure if I could say which one of these is the most important, or if you were to remove one of those problems, would things have been okay? It's not possible to really go that far, but it helps us see what are some factors contributing to the poor performance. And then the third way we used these findings was in synthesis across pilots. And this maybe helps us to move on from just understanding what happened to thinking about how might an AMFM intervention work in other countries in the future, to try and extract what were the key factors that were maybe facilitating across all pilots, what factors were perhaps associated with the best performing, and what factors were associated with weaker performance. So I've just given some examples of those here. So in terms of the lessons learnt, I think it was incredibly important to document the process of implementation. When you have such a large-scale, complex intervention, it's being implemented in a messy real-world setting. And also very important to really go to the countries and talk to people and get the data on the ground. And that's certainly important to send lots of healthy skeptics to collect the data, as John mentioned, to make sure we get the real story. Also, context was incredibly important. I think we ended up thinking that context probably made the most crucial difference between countries in their performance, and trying to drill down to what elements of that were important was central. Qualitative methods, as I said, were clearly essential here, but we also found real value in, even if they were crude, having some sort of quantitative measures of implementation strength to really help focus our analysis. So thank you very much, and I just acknowledge again.
Thank you, Catherine. I think you are the next in line.
I'm going to go to a slightly different point in this, because to me this session is about how do we do analysis and interpretation as well as possible to generate useful information for programs and for the other audiences that are there. And at times we are using mixed methods, but at other times actually we're using multiple methods, right? And it depends on, again, what that nail is and which hammer you're using. And it's just a reminder that for each piece of these complex evaluations, we don't always have all the parts of the triangle available.
Absolutely.
And therefore, it's not always a triangulation exercise. It's really a quality of data analysis, quality of data interpretation exercise where triangulation, when we have multiple data sources, may be the appropriate tool, but it's certainly, to my mind, not the only tool. And I'm actually going to pick up on a different piece which was in the planning document, which is how do you triangulate amongst an evaluation team? And people have heard me say this. It's very easy to talk the talk of multidisciplinary science. It's much more difficult to actually do it in practice. And the structure of evaluation teams, I think, is absolutely crucial, both by disciplinary expertise. We were fortunate that the PMI organizers imposed upon us a motley crew. We had an anthropologist, we had an epidemiologist, we had a clinician, we had a district medical officer from Africa who had a lot of practice experience at a district and sub-district level. It was truly a diverse team, and I think one of the key things in doing this is actually, it's easy to say celebrate diversity. That's a hard team to work with, right? And I'm sure the other evaluations have had that. And I talked about the importance of healthy skepticism. But there's actually another piece to that, and that's the respectful, healthy skepticism. And one of the things we did on the PMI team is for every sort of key issue, we took the person who clearly had the dominant expertise, and we matched her or him with somebody who was completely different. So, somebody who would just take a different perspective, such that when our team got together, there was two presentations of their interpretation. They didn't see them beforehand, right? Of what they actually thought the data said, okay? To see if we could actually elicit a richer understanding of this. And that actually made for some fascinating arguments, and at times we'd have to reiterate the respectful part of that because people can get quite passionate about their points of view of the world and how they interpret things and whatnot. But I think it it's a healthy approach as we actually get operational in the guise of how do we actually do this. I think it's also important to realize that, to me, there's a positivist bias of validation. Can I strangle the data tightly enough till I get it all to say the same thing? Okay? And I was interested in your 35% disagreed, but by the end of the day, hell, you'd beat them into only 7%.
Come over to deceive.
Right? And in fact, I think that's the sort of, we often go in that way, when in fact, true difference may exist and discordance may actually be informative. And a couple examples of why, in fact, we might actually be less worried about discordance. And some of it is related to timing. In all the evaluations I've done, the organization that people speak about is at the moment in time that they had interaction with that organization. And I got one going on right now where they say the board is worthless, right? And what they're really talking about is something 5 or 6 years ago when they were an unhappy board member. Yeah. Well, in fact, the board is very different now than the board was 5 or 6 years ago. So you could have two completely discordant perceptions of what's going on at the management function of the board. Both could be true. Yeah. There's been a lot of change. And on all these evaluations, we're looking at 3, 5, 8-year periods, and we should be very careful about the timing of the slice of information from the informant or from the survey, because DHS are retrospective looks. The mix were done at different times. The MIS are at different times and different quality. And there are different levels. And what it might look like from a sub-district personnel who knows that their stocks run out on day 10 of the month, but also knows that their district medical officer never sends a stockout report up the system, then you might hear that the system works for the first 10 days of the month, has no drug the last 20 days of the month. The DMO will tell you system works, and as it rolls up, as we talked about earlier, as it rolls up to national data, and Martin said, be careful because you roll up crap, you got big crap, at national level. So all those are true, and we've got to deal with that practical reality that at level and at timing, there can be discordance, which is actually informative. And I was constantly working with my team about let's not beat it into agreement, because I think the bias is to beat the findings into agreement and whatnot, and that's sort of the discordance analysis, or using different data sources, different methods, different levels to try and make sure that our interpretation of our findings is as rich as possible. But I'm going to give you another anecdote, and that's the worrisome of concordance. And this is the one that really worries me. We know how strong the respondent bias is in all this kind of work. And even a healthy skeptic can get snowed every now and then. So I think we need to be careful when, this clearly is to use your phrase, a viable finding, because everybody told me it.
Also the data.
And the data, which I don't trust. So it's again, that healthy skepticism, we shouldn't move very quickly to, can we understand the discordance? But one of the things we did in our team each time was we say, what does everybody agree with, and do we? We actually looked at the strongest findings, right? And a fascinating thing occurred. We were in both French-speaking countries and English-speaking countries. And I do not professionally work in French, do not have the language capability to work professionally in French. And we found that the French team had quotes in their field notes from a certain group that were identical word for word for things that I had heard in English-speaking programs. And it was on a key issue. And I never saw the memo that generated what the talking points were, but it clearly was there, okay? And the people in the country had gotten marching orders on what the story was going to be regarding this particular question in the evaluation, right? We had absolutely strong concordance. It was nonsense. was absolutely nonsense. It was a political decision made by leadership to position a piece of the project in a certain way on a certain particular issue. And in many hierarchical organizations, people do what their bosses say. That's why I hang out in universities where you can, get away with doing that less. Yeah. So it's a reminder that as we think about triangulating data or using mixed or multiple methods in order to try and come up with the best possible information to improve program performance and guide the program personnel, that we are a little cautious both on beating our discordance into concordance and in trusting concordance as a true finding.
Thank you. I think, Sangeeta, it's your turn now. Interesting.
Yeah, I think I'm going to follow in the lines of John in a way where I think I was asked to come here mostly. I was the team lead for the study area 2 of the 5-year evaluation of the Global Fund, but since then I've conducted and am in the process of conducting other large-scale mixed methods evaluations, very largely case study. And every time I do them, I learn something about how to do the analysis better and how to document the analysis better and do the triangulation and validation better so that we can, because I have also had, we've had issues with how do we deal with the discordance? How do we test whether our concordance is real or, just something that's expedient at the time. And so I wanted to talk more about some nitty-gritty processes and functions, I think. So carrying on from what you're saying, we're concerned about ensuring that our data is as good quality as we can possibly get, so we have confidence in the findings when we get there. And so we need to think about validity and reliability, regardless of what method we're using. And I will support what John said. Triangulation is one method to help with these things. And depending on what you're trying to do, whether you're trying to establish construct validity or external validity or reliability in terms of getting the same information from the same sources, being able to replicate, or in terms of the interpretation of the findings, you will need to think about different ways to use triangulation to help you out with those. So triangulation, again, is not, I was interested, Carlo, when you said we know what is triangulation. I'm not sure that we know. I'm not sure that we have a principle and maybe an objective, but I think there are many different ways to do it.
Definitely.
And you need to be mindful of choosing an appropriate way depending on what your objective is.
Yeah.
And I happen to think that the theory of change is your touchstone for all of that. It's really your analytical framework in this whole process. And you have to be willing to also approach your theory with healthy skepticism and make the modifications and changes as you learn from your data and learn through your analysis and validation. We also have been talking about mixed methods a lot, and I mean, do we all have the same understanding of what mixed methods are? I'm not sure about that. In my experience, clearly people have different understandings of what we mean by mixed methods. And again, depending on how I don't want to get into how should we define it, but in general we talk about a mix of quantitative data, which I will think of as being something that you can use statistical tests with, and qualitative data, which can be numbers, but usually doesn't lend itself to statistical inference. And we talk about trying to combine those for a perspective on whether a program works or not. And we have a lot of issues in terms of trying to do an integrated analysis of these things. I've heard a lot of people mention that we integrated quantitative and qualitative data. Well, I'm really interested to know how they did that, because I've done it a different way for pretty much every mixed methods evaluation that I've done. It depends on so many, it depends on the question of the evaluation, obviously, and the different data sources, but it also depends on the formats of the data. Just to give you an example, so with the 5-year evaluation of the Global Fund, we had, like 867 sort of primary documents that we coded. in Atlas TI, which is a qualitative data, I'm going to say management software because it does not actually analyze the data for you, just to make that clear. And Atlas TI and its functions allowed us to do certain kinds of triangulation and validation because of the way that it presents and shows the different codes. So you can take a look at whether you have concordance among levels, among different sources, different countries, et cetera, just because of the way Atlas generates its output. Recently, we completed a multi-country case study of routine immunization in sub-Saharan Africa. This was a Gates-funded evaluation where we were asking what has driven improvements in immunization performance. Well, in that case, we had not only interview transcripts from every level of the immunization system, but we also had the program data. We had the mix from some countries and the DHS as well. And we used NVivo instead of Atlas TI. Well, that meant that we had to do a completely different way of integrating the data because we couldn't use the program data, which was in Excel, in NVivo. We couldn't actually see all the different codes and levels with the way that NVivo generates its output. So we ended up being very manual. We made systematic formats that every analyst had to use. There were 4 of us. And we extracted data, and we had categories, supporting data. We called it divergent data, not just contradictory, because there were things that were more like the absence of something, and we wanted to make sure that that was included. We had to, in that Word document, had to document the levels where there was concordance, discordance, et cetera, and the different sources. So was it an interview, an observation, was it program data, et cetera, et cetera. So we put this all together by theme. We had already identified some themes, and that's how we started to say, okay, are we actually reaching consensus on an understanding on a key preliminary finding, to use your language? That went back to an external evaluation advisory group, and as well as the larger team and the country teams for validation again. We had many other steps in country for validation of the findings before we even got to that process. But this was this process of integrating, because you need to integrate the data in a reasonable way if you're going to understand how much you're validating, what you're validating, and what's actually triangulated. I'm currently the mixed methods advisor for the MEPI coordinating center at GW. And what we do annual surveys of all the 13 universities, and then we also do site visits every year. The nice thing is that we didn't think about this in the beginning, but the surveys were put into an Adobe PDF format, and the schools can complete it in the Adobe format, which means that we can actually code those surveys, which have a lot of open-ended questions, in NVivo, along with the interviews that we do on site visits using the same coding plan. So we can actually do a much more easily, it's much more integrated analysis of the different sources of data than we could with any of the other evaluations that I've done. And it's simply a functionality of the software and the way in which we structured how the data was collected and stored. So, these are the kinds of nuts and bolts that I think we're talking a lot about, and I think it's important, but it's also, there are some really, really basic functionalities that we have to consider when we think about integration, right? We want to integrate our qualitative and our quantitative data. We want to validate. We want to triangulate. Well, I think it's important that we think about what are the mechanisms by which that's actually going to happen ahead of time, because I've also been in the situation where you end, and then it's like, oh God, we have all this information, how are we going to integrate it? So those were some examples. And then I just want to also talk about, if I'm not running over, synthesizing, because one thing is to get to key preliminary findings, which I didn't quite know whether you use that matrix within a country just for one CPE, or if you also used it. So then there's the other thing about what do you learn from all the countries, and are there generalizable, that's a difficult word, relevant findings that you can draw out of the context and use in a larger, in a wider perspective. And that's really where I find that, we need to do better with mixed methods methodologies in articulating what do we need to do to ensure legitimate synthesis and legitimate sort of drawing of more generalizable findings. I think this process of validating key preliminary findings among the team, I think that's incredibly important. I also feel that when I put together teams, I try to make sure I have divergent perspectives, because you're automatically getting that challenge in that process. But also with the people or the program that's being evaluated, I think it's without losing your objectivity, it's important to know if you, as external evaluators or semi-external evaluators, are, out in left field compared to these people that have been implementing this program for 3, 4, 5, 6 years. That's another kind of discordance that you have to sort of deal with and figure out how you're going to work with that.
Sure.
I also actually now require on my team, when I do qualitative work, interviews, I require the interviews to be done in teams, so that there's 2 people listening to the same response and 2 people who hear something, and they have to make sure that they agree on what the respondent actually said, so we can reduce the whole sort of anecdote problem around, or opinion problem, around each individual interview. I also have, with my teams and in the last 4 evaluations, mixed method evaluations that I've done, I've made sure that we include an articulated process for alternate theory testing, that we make sure that we challenge our assumptions about the pathways by which these outcomes or impacts were achieved or not achieved. Did we fill in the data boxes for every step in the pathway? And is there anything else that can explain that arrow? What else was going on? And in that way, we get to a greater level of confidence with our findings, and we document this. We document it. And then the context issue, because we really need to take, if you want to synthesize findings, you have to kind of take out context. And you take it out by actually putting it in and describing it really well, so that you understand how it's influencing either the implementation process or the outcomes achievements. So we go through a specific analysis step specifically on the context and mediating factors. Are they still context? Are they still mediating? And then by understanding how context fits into our theory, we can then say, all right then, now we fully understand how context is influencing, so we can talk about our findings leaving the context out, so that we can then think about it as being more generally relevant. So those are some of the things that, a lot of this started from learning from the 5-year evaluation of the Global Fund, where Study Area 2 asked some questions that had never really been asked at such a scale before, and required a creativity with methods that I think was quite new and innovative. And since then, a lot of learning and a lot of progress, I think, has been made in mixed methods analysis, and I would say not just triangulation, but sort of validation and confidence building in the findings.
Thank you, Sangeeta. I think, Bridget, last panel speaker.
Yes. So I think I'll reinforce and maybe add to both some of the principles that have come up and also some of the nuts and bolts. I only have 1 slide, so I'm not going to stand up. I'm really just changing what you see in the background for those of you who are visual and maybe need a little bit more color. I think and I'm using the Institute of Medicine's evaluation of PEPFAR experience as kind of the framing example for these thoughts. And in that experience, I think our process of analysis and interpretation really had a lot of layers of embedded and integrated triangulation processes. And some of these have come up already. Triangulation among different data sources, triangulation among different investigators, and then also triangulation among different subsets of the initiative that were represented by the different data sources. And it was really, what we focused on the process is that it was the resonance among these different triangles and the different points of the different triangles that really enhanced our trust in which conclusions were reliable and credible and how broadly those conclusions applied. because we were charged with this whole of initiative frame. So we had to always report on that. And I say resonance as a specific word choice because it doesn't mean concordance. So sometimes what resonated was that it was mixed. So we didn't throw it out if it was discordant. We reported discordant findings, and if there was evidentiary support, talked a little bit about why they might have been discordant. So it was really what emerged as resonant was the wording that we used. And Anne has already described, and Deborah as well, that we had a range of different data sources, which this is a shorter version of Anne's green boxes that you've already seen, and that each of these, because we didn't have a lot of data sources that were available consistently across all of PEPFAR, these each represented different subsets. So we ended up with kind of nested cases, each of which represented overlapping but not exactly the same subsets of the program. So a few key points to highlight in what we tried to summarize here in a figure that is intentionally a triangle. Just felt like I should, just in case you didn't notice the triangle. One is that we really did not take an approach in which we tried to integrate the data. So we really thought about integration happening at the level of analyses and interpretation. There's sometimes a gray area in between what's data and what's analysis, because you're thinking about what the data mean even as you're looking at the data. So that's, I don't say that as a black and white. I think there's kind of a spectrum there as well that we could maybe talk about more. But we really tried to focus on, within each of the different data sources that we collected, doing some rigorous methods for data collection and rigorous analysis within each type of data, matching the appropriate methods to the types of data that we were using. And I think that it's important to note that, because I think there is a range, but it's very important to be intentional upfront about when you're doing the mix, so that you're being purposeful and rigorous and using appropriate methodologies in terms of when you put things together and when you keep things in terms of what they mean on their own. And that's where the phrase, which actually comes from Larry Aber, that you have mixed methods and not just mixed up methods. We had a number of different types of analyses, which Deborah talked a little bit about in terms of having some time trends, progress toward benchmarks, analysis of barriers and challenges, content analysis from the document review. So some of those approaches applied to multiple data sources, but were applied in a way that was appropriate for each source. And we started even within these green boxes at the level of triangulation among investigators. So a very similar principle that John was talking about. For one example of that, for our qualitative data collection with our interview data, we had several layers of investigator analysis. One was that country team in country did debriefings on an iterative basis after every interview, after every day, every week in country. So that was one process just among those team members. And then subsequent rounds of analyses that started to look across countries were done by different members of the evaluation team, so people who were not necessarily in that country. And then those initial narratives were then read by second readers and third readers, and then large groups of readers who were then looking at whether that resonated across countries. There were a lot of group discussions. The staff had more opportunities for group discussions because we were all co-located. For our committee members, that was more reading. So reading and responding was how that iteration worked, the nuts and bolts of that iteration. And Sharon will talk tomorrow in much more detail about our qualitative methods for people who are interested in that. So that's kind of that from the green box to the first red box of analysis and interpretation within each data type. The next layer was really then trying to think about what these things mean together across the different types of data sources and across the different subsets of the country, and thinking about how widely are these things applicable, and if they're only applicable narrowly, what do they mean within that narrow scope, and trying to be transparent in our reporting about what scope is represented within each chain of findings and conclusions and recommendations that we were making. So that's that second red box, and the triangulation across evaluators within the evaluation team continued throughout the process. And I think something that's important to highlight is that this was very iterative, and all of you have described that process as well, which is that there was, from the second red box, we would sometimes go back to the first red box and just see, do we need to do some more analysis in detail? In some occasions, we said we have to go all the way back to to the green boxes and collect more data, or go back to the data that we had received, ask for different kinds of data for some of the secondary data that we were receiving. So a couple examples of that. Once we received the program monitoring data that were available to us across all of the countries that were within our scope, we got a sense of how limited the findings would be from that data source alone. And then that really informed the kinds of requests that we made for other clinical data. So we requested clinical data from the CDC for a subset of partners, and also from partners themselves. So that was very much informed by what the gaps were from the program monitoring data. And I think we would, I think, across our very, very large evaluation team in sum total, the outcome of using this approach within the data sources and then triangulating among them really was critical to being able to draw credible conclusions about the performance of PEPFAR and the effects of PEPFAR, the results of PEPFAR, even when any one data source was not sufficient, or when any one methodological approach was not feasible or not reasonable or not appropriate, given the data that we had. And since we didn't have any data sources that were truly representative across the whole of PEPFAR, it was really critical to have that complementarity. And then to be, as I mentioned early, when we did state findings and draw conclusions, to be transparent about what the evidentiary support was for each of those findings and kind of how far we were able to get. How many points there were in the triangle. Sometimes there was only 1 point, and it was a line. Sometimes there were 8 points, and it was whatever an 8-pointed figure would be. And to also, we really tried to embrace documenting the methods and what we did as well as we could. So, all of what I just described is getting us to the whole of PEPFAR point and the final report. And the visual aid for what happens when you do all of that is that you end up with a big 800-page report, of which we did bring a few copies that we really don't want to carry home. So if anybody really wants one, we're happy to give it to you as long as you promise to use it for something more than propping your desk or your window, like in Simon's picture early today. From our perspective, using this approach really did strengthen the quality and credibility of the evidentiary support. And we were charged with making recommendations, so it was really critical that those recommendations have a strong evidentiary support. And part of that was doing this systematically. So we didn't use a matrix for this, but we organized our report sections in a very consistent way, using our program impact pathway framework, and talking about the findings within data source and then drawing conclusions across data sources. And so that when different groups of investigators were reading it, they had a systematically organized document that they were responding to. And I think very similar to what we started out with is that these different data sources really help you. They can allay concerns about a particular bias you might have because of what a particular kind of data is good for, and also the limitations of how broadly the scope was represented. And I think for us, it also really helped us maximize the use of our program impact pathway or our theory of change, because what we were able to do is, depending on kind of the case or depending on what data sources we had and how much triangulation we could do, we could get further along our impact pathway in some areas than in others. So we didn't have to, across the whole report and the whole charge, default to the kind of lowest common denominator of available useful data. If we had had to do that, we would have had a very short report. So it really allowed us to have those different layers and to be able to report them transparently, but still think about how they all came together. The reality of this process is that it's very time-consuming. I think just from what you've heard, you can imagine how much time each of these things are taking. And we had, at any one time, about 8 staff, 3 consultants, and 20 committee members. So that's a lot of extra people thinking. We did divide into working groups, and there was kind of mixed expertise on each working group. So that was kind of a similar approach that we took. But ultimately, all 20 of our committee members had to reach consensus on our conclusions and recommendations. So at some point, they all had to agree that they had the same level of confidence in the evidentiary support. So all 20 of them really had to delve in. And that was not just kind of an time and intellect resource-intensive process, but it was also very operationally challenging because it really meant thinking in advance. How can we produce interim deliverables that people can look at and respond to, and how can we be doing this in a way that's both iterative and efficient for our committee members who were all serving as volunteers. So just trying to think about how to balance all of those things operationally was really important. And that leads me to something that was very similar to what you just said, which is that the analysis can't be something that you think about at the end. We'll collect all of our data and then we'll decide how to analyze it. You might not start the analysis. You start the analysis at some point along the way within the sources, across the data sources. But at the very beginning, you have to be thinking about how can we make our data process, data collection, data request process iterative and flexible, and how can our framework be flexible? How can we be ready to respond to what comes out of this iterative process? And I think the question of what is the area between triangulation and synthesis, our experience was really, that was definitely a blurring there for us. So it was interesting thinking about Simon at the very beginning of today, talking about synthesis and triangulation and thinking about those are kind of even on everything we're talking about is on a continuum, but you raising that really resonated for me in that way. That was my timer, so I'm going to stop.
Wow, very efficient. She had a drill. I didn't even have to stop you. So I think that my hope to stimulate the discussion was overcome. I mean, there has been a lot of reaction to what we do at the JEF Evaluation Office. So I think it's interesting. It's already useful to this audience, of course. And therefore, let me just start off the question and answer session by giving a couple of elements more to what I said in the beginning. It's difficult to describe in 20 minutes the way you do evaluations, I think. Of course, we do diligent process. Of course, we have quality assurance. Of course, we have a situation where you don't have a triangle because you have only one angle. A situation where you have a prism, where you have a huge. So what I described is a procedure. It's not a method. It's a way of doing things. So all your points are very much valid. I mean, we are often in situations where we question the validity of the data that comes out from a method. That remains a problem. So the issue of data quality certainly is there. But we find it interesting because we are to use this systematic procedure because we have the same typology of evaluation to be done in different countries in a situation of absence of a theory of change, because the GEF support in 20 years has been a project-based support, and there's no country program. So we have devised the standard terms of reference with standard evaluation questions that we ask all the time. What have been the results at the project level or at aggregate level in biodiversity? This is a question that we ask all the time. What have been the results in climate change? We ask this all the time. We have indicators that we look all the time. What are the GHG emissions in a country? What are the species that have been preserved in a country? And what were before, what are the number now, etc. So the points of the theory of change is very interesting. And as a matter of fact, the office is getting to that point in the overall performance study 5, which has just been issued, which is the big study that our office does to inform the next replenishment phase of the GEF, has done analysis based on a heuristic general theory of change that is applicable at different levels, project level, system level, country level, and that can be used as a reference. So we are getting progressively there. But still, I believe that there is a value in having a standardized, a systematic approach whenever you can. We also have evaluation that where we cannot apply such a procedure. For example, performance evaluations, they are based on terminal evaluation reviews of each project that has been completed that are grouped together, and we count assessment. We cannot, I mean, there's a specific way to do that performance evaluations, and so there's no space for triangulation there. So, but nevertheless, very interesting contributions. I like your point on the timing. It's very interesting. Sometimes, let's say, not divergent information comes from different moments. And certainly this is something that, that could be taken up in the further development of the method. I would like to stop here because time is short and maybe there are questions in the audience. And I would invite those that are in the room or at the webcast to come up with some.
Can I ask, make a comment, ask a question? Simon, I like your idea of divergence and dissonance. A cellist once said to me, good harmony needs dissonance. And the Prime Minister said to me once, if around the cabinet table at first go, everyone agrees with it, something is wrong. Something is wrong. It is a good dictum. If you run at me, everyone agrees something is wrong. And it means they haven't taken the effort to look at the problem. But my major point is, I'm worried about the triangulation. I used to learn that triangulation was something that came from surveying, where you had 3 points, and you used 3 vectors, and you found the locus. But I hear triangulation relationship to 2 things. Qualitative and quantitative methods, you talk triangulation between them. To me, that's not possible. You can't have triangulation between 2 points. So I'm interested in whether there's a divergent view of what triangulation really means. The other point I'd be very happy, that would help, you know, in, I like your analysis of the, how you use, and yours as well, how you use the different methods without actually calling it triangulation, how you use various methods. I prefer that rather than the denomination of triangulation. But a final point I would make is relation to the context. I'm concerned we hear context used in different ways. This one, Eliot made the point that he considers context at the beginning, at the end, and not at the beginning. That worries me. And I heard you use it as I understand it, that one must consider the context throughout the whole process. And that really, do you have any difference with Eliot, or those are the points I would make.
Elliot,
Just
in
arrived.
time.
I think this.
Are we taking more questions? Okay.
Hi, I had one question about this iterative process. Because if I understood you well, you go over things, and then there is a final process that you described as now we have to come to some sort of consensus. So iteration I understand, but what is iteration if it has to, in the end, lead to this consensus? What is the consensus drive? What is actually happening there? I mean, I liked both the last 2 ladies. I really liked your sort of more detailed nuts and bolts description of what's ongoing. But this iteration sort of stuck in my head as what is actually happening there?
So maybe
Why don't we-
you want.
George, we must have gone to the same school, though I think you probably went a few years earlier than I did. So when we had observation data and interview data and quantitative data, then in fact we could look at those 3 data sources and say, are they saying the same thing to us? Is what I observed, what I heard from the participants, and what the survey information informs me aligning? And I do think in those cases you can triangulate. I also have trouble getting a triangle out of 2 points. Geometry was taught a certain way, I guess, at our school. So I fully agree with your caution, and that's why I think multiple members of this panel said it's multiple methods, not always mixed methods. And what's the appropriate tools to analyze the data sets that we have? And triangulation as an approach or technique, which I think, I don't remember Catherine was here, Sangeeta said, it's one of our tools in our toolkits, but it's not the only one. And I think that, I think you reiterated that quite well.
So I'll just say that I don't think I have any difference with Eliot. I think if we believe and use a theory-based approach to evaluation, we think about what could be. We used all those different terms this morning, supporting contextual mediating types of factors at the beginning, but I think sometimes what we And then we have to come back to it at the end. Again, that's really where we think about it in the beginning. We hypothesize about it. We try to identify so that we can plan to get information on as much of it as we can anticipate. But as Elliot said, a lot of the time, in a more grounded theory kind of way, the context comes out from your data also during analysis at the end. And then you have to go back and take a look at your theory again and try to understand what is really context. But defining it first in terms of the boundaries and what is your unit of analysis, that's an absolute must in the beginning. That's an absolute must. You're lost otherwise through the whole data collection and analysis process if you don't do that work. I just wanted to just mention about iteration.
Yeah.
So in the Africa Routine Immunization Systems Essential, the ARISE evaluation, we had multiple case studies, and it was sort of a positive deviant approach. We selected countries and districts that had improved, and then we had a negative case to try in a district that didn't improve in the same time period. And so what we had were 3 different country teams. We had 12 different districts, and we had to somehow, from that, our mandate was to help Gates determine where to invest, in their new immunization strategy. So we had to come up with things that we all felt confident about, that were good ideas to help a major donor put their money in the right place. But we wanted to do it in a way that was methodologically rigorous and that we all felt comfortable with. So we had each country produce their own report, and specifically for the country, the teams led that, and then we brought all the teams together in a workshop to then start identifying these findings and the words that are used to really start taking them apart. What's the essence of those things? What's actually common in all the country findings? And from there, we reached consensus. Okay, these are the common things. Then we took those and used them as coding themes and applied it to we pooled all the data. So first we did the within case analysis to come up with what direction should we go in. Then we did the cross case analysis to sort of say, all right, given these themes, this way of looking at common drivers, what's the data to support, to not support, et cetera, et cetera. Mm-hmm. And then, again, we had an external evaluation group, steering committee, who then also vetted the whole report and so on. So we reached consensus because we knew what we had to deliver, but we tried to do it. But we all felt a little bit uncomfortable that we didn't actually have space to talk about the discordant types of things or the findings that were resonant, but they were very particular to, say, Cameroon, right? We didn't have space for that in our deliverable.
The reason why I'm asking the question is exactly this. What if the Gates mandate had not been there? Or what if it had been a slightly different? So what space is actually given in this reiterative process? Yeah.
Well, I can maybe speak to the consensus process in the IOM to add another example. And the consensus process is a specific thing in the Institute of Medicine for any study that we do, so not just for evaluations, for any consensus study that we do. That's the standard that we're held to in order to arrive at recommendations. And I think there's a couple of things that we can think about in terms of what it really means to come to consensus, because we really focus on prioritizing recommendations around the areas where the strongest resonance emerges, in really priority areas where there's a lot of agreement about what the data mean. And what the conclusions mean, and areas where actions are warranted. So there's a certain prioritization that happens where the recommendations really represent the strongest areas of consensus, and also the areas that the committee agreed were the most important for the use of the evaluation. But the report contains a lot of information that isn't necessarily at that level. There still had to be agreement because the committee all had to agree. They agreed to author the report as written. But a lot of the areas that are a little bit more messy, it's not exactly clear, there's a lot of different things emerging from the findings. That's where, in some cases, we didn't get any further than just stating the findings, and you can think about that yourself as the reader. In other areas, we drew conclusions, so there, it seemed like there was enough to say, this is something comprehensive in synthesis that we can say. And then in a subset, it's kind of a funnel down to the recommendations. So part of what came out from the iteration process is where in that range things fell in terms of the final report.
And just to follow up, there was also a time issue, right? Once we sort of identified the sort of discordant or highly contextually specific resonant findings, we found them very interesting and we documented them, but we didn't have the time to really go back and figure out how that fit into everything else. That really required another stage of analysis where we would have needed to go back to the raw data and do some recoding and all of that kind of thing, and that just, the timeline didn't allow that. But we were clear about the fact that those things were there and that they it would be interesting to look at them more.
Could I comment on the triangle? I think the triangle is a metaphor.
Yeah.
I don't think there's anything magic about the number 3.
No.
But I think the metaphor came from, the fact that triangulation exists. I don't know, maybe somebody knows the actual history of why triangulation became the term, but
It's that survey thing.
yeah, I think it probably comes from that was the traditional way of, getting a consensus from the multiple points and what was the minimum that you needed from surveying. But I think for the purpose of, and the minimum being 3, but I think in some cases you need 8 to really trust that you have resonance.
Absolutely.
And in some cases you feel, well, I was asked to do this particular narrow thing and I only need one data source and I can be confident that it's reliable with one. So. Well, that's I don't know that I have the power to introduce a new term, but
so I had a couple of questions in mind that I wanted to ask. Let's go to the audience first. 3 questions in the audience, so please go ahead. I will keep mine as the last.
Hi, Callum Davian from the London School of Hygiene and Tropical Medicine. We heard a bit now about how plans and almost like procedures are quite useful, but also quite a lot about how this process can be quite data-driven and you can sort of go back and forth and whether it's iteration amongst discussants or iteration actually right back into the field. I was wondering how that second way of thinking about this process sits in the medical establishment, which is so wedded to the idea of pre-analysis protocols and the sort of principle that the validity of findings is really based on having blinded statements about what should be done in the analysis.
And maybe we keep the 3 of them and then.
Okay, my name is Dorothy Moroki from FHI 360. I have a question on is there a balance between and the term, John's term was used severally in this panel, healthy skepticism and triangulation. And the reason I ask is because there is a sense in which I think listening various, and I think, Carlo, your presentation where you talked about the different approaches, the triangulation that seeks to validate the data, that means going deeper and probing further. And then against the backdrop of where, John, you talked about the supposed memo that had gone out in Anglo and Francophone, part of the world. Just so what are your thoughts on in terms of that balance, so that the triangulation or the mixed method approach is not just used to be a validation tool? Is there something therefore that needs to have happened with the stakeholder engagement process to sort of create that balance? That's my question.
Yeah, I had just a quick comment on the triangulation and then a question. It may just go without saying, but I think none of us select multiple methods either as co-equal points of a triangle or at random. We're all very aware of the specific limitations of every single data gathering source, and so the triangulation process is about looking at data sources that don't have the weaknesses, looking at complementarity to make up for weaknesses in each source. But can you talk a little bit about this point about the time required for a meaningful analysis? Because I think we've all seen time and again concern about sample sizes leading to an investment of the maximum plus time for data collection and then a compressed time for analysis. And I think if this group says something plonking about, guarding your analysis time, it could really help in guiding future plans.
Yeah.
Okay.
So just to address Brazy,
Yes.
is that okay?
Yeah, of course, of course.
So that's been one of the biggest battles. There was a related question on how the medical establishment looks at this kind of iterative process, and I think in my experience over the last 10 years or so, there's a greater comfort and acceptance of that there needs to, that the rigor of analysis for mixed methods is different than the rigor for analysis just based on statistics. I think there's a greater comfort level with that, but there still, I believe, is not a great understanding in how that translates into actual execution of all the activities, where there's still an idea that, as with survey research, the bulk of the time is with gathering the data and then entering the data, and then the analysis can be done like that and reproduced because you have do files or whatever. Whereas really a big part, changing that balance a little bit and making it very clear that analysis starts with data collection, it continues through, and it continues afterwards, and it's much more time-consuming and resource-intensive to do the analysis of qualitative data, essentially, like where we're not doing statistical inference. And I have also learned to take an audit mentality with that analysis process, because I find that related to the discomfort or the less general comfort level with a more iterative, qualitative approach to analysis is this problem that you can't, it's not easy to reproduce how you got to your findings. So the time that's required to document every step of how you got from raw interview data or observation data to key preliminary findings is always underestimated, by 100%, I would say. And we don't think enough about, if we're demanding rigor and we're demanding confidence in the findings, and we want people who are more epidemiologically oriented to feel comfortable and stand up and promote these findings, well, what can we do to help them? And how do we help them understand everything that's needed so that they also can feel confident, and that in some ways the analysis is more, it's not ever going to be completely reproducible, but it's at least a little more transparent for people if they wanted to go in and look at the raw data and draw conclusions themselves. Mm-hmm. So I think it's an ongoing challenge that we do absolutely need to have more conversations with the commissioners and so on of these kinds of evaluations, so they understand that if they want that level of rigor, then they need to build that in for analysis. Mm. I don't know if anybody else agrees with me.
Thank you, Sangeeta.
You have something? Go first, and then I'll go. I didn't know whether. Okay.
I just wanted to respond to Callum's point. I thought it was a really interesting one about the emphasis in, say, more traditional randomized trials of having a pre-analysis protocol and of keeping yourself honest by sticking to that, rather than running around doing whatever subgroup analysis you can to try and dredge up the finding you were maybe hoping was there. And I think that's in some ways another element of that is people are beginning to publish their protocols at an early stage. So journals are publishing protocols. And when I've watched people do that, I've sort of thought, oh my goodness, is that what I'd want to do? Because in some ways, my protocols have evolved over time. And I think when you're talking about these really complex interventions, when we're not actually sure what the pathway really is to impact, and to pick up again on Elliot's point, you realize at the end what was the contextual factor that might have been important, and then you want to go back and collect more data, as you were saying, to validate that. Maybe we want to make a virtue out of that to some degree, that maybe it isn't appropriate, but it's probably good to be mindful of the rationale for that approach at the start and think what we could be losing in doing that. And maybe the most important thing is to document what you did that was in your original plan and what you changed over time, so at least you're honest with it.
Thank you.
If I may, Carlo, 2 quick points, one to Dorothy's comment and one to Brazy. It's fascinating to me that we're ending on the questions of balance, because we started the morning on the question of trade-offs. And to me, they're 2 sides of the same coin. The level of rigor required for program decision making and for program improvement is not a single known entity. And therefore, I find your question of what's the right amount of time or the balance to be possibly not actually an answerable question, because I would like to believe that we do the most rigorous analysis necessary to meet the needs of the program to improve or to meet the needs of the evaluation and whatnot. And that's going to be highly variable. And I think often we allow rigor to get in the way of utility and usefulness. And I think we could back off on rigor and be more incrementalist in the public health world, and get on with actually improving programs and generating social change. And that's where I'd end up on that balance point. And in a way, it's similar, Dorothy, to where I would end up on where's the balance between, healthy skepticism and triangulation. I actually think we want our evaluators, who are external to our programs, to have a healthy dose of respectful but skepticism. And I think that that's actually the contribution that external evaluators can make to these programs. And it's interesting to me as we've had examples of groups that are doing high quality, useful evaluations within, how they will structure that externality and that healthy skepticism. Because again, I'm an incrementalist. Let's make the world better before we make the world perfect. And so I'll stop with that.
Thank you. Well, I think we run out of time, including for my question, so I will keep my question for the after one. And I'd like to thank very much the panelists and the audience for the interesting discussion. It has been an interesting experience for me. I really come in a new world, and I learned a lot. Thanks a lot, everybody.
So we're just going to give Anne the last word for the day.
Well, I'll keep it brief in the interest of everyone's fatigue levels, and thank you for the persistence in staying on, both in person and on our webcast. But I do think actually what John just said framed the day nicely. We did see some congruent themes emerging. We all, I think, have some consensus around the importance of evaluations to make a difference. We started the day with Simon Hurd, who gave us a framework and some tools and tips for choosing between the actual multiplicity of methods that are available, which is a good thing. That old dichotomy of you can only do an RCT or only do completely qualitative social anthropology, that argument has really been put to rest in large part, as Chris Woody pointed out. In panel one, John Simon also pointed out specific trade-offs that we all have to make, and that was the morning theme, was trade-offs. Deborah Rugg, I thought, gave a very inspiring example that evaluations can be quite efficient. She talked about the one-year cycle that they have with the UN programs that are under her jurisdiction. Chris Whitty also talked about some pretty deep political issues that are often masked, I think, when we talk about doing this work in public, including some issues around complexity. And I'll take the liberty again of paraphrasing what John Simon said, that, again, perfect design is the enemy of the good enough evaluation. Panel two, we saw the PEPFAR program impact pathway example. Daniel Low-Beer talked about the Global Fund model, which has moved from 5-year evaluations to rolling 5 years of evaluation, kind of an approach, building evaluation into the business model so it can be used for management and measurement. Catherine Goodman talked about success metrics that were outlined in their evaluation. Elliot Stern talked about ways to reduce evaluation crimes that some of us or all of us may have committed at some point. And I found it cheering that he called for more high-level investment in quality evaluation by careful framing of the questions to the methods. Panel three, we talked about some universal data difficulties, availability, transparency, quality, and so forth, the importance of having financial data as well as program data to assess value for investment. And there were some pretty deep and thorny issues around data ownership and sovereignty and access. In our last panel, we talked, I think, a lot about triangulation and methods, mixed methods, and what these terms might mean, and the importance, as Bridget pointed out, of having some flexibility in our framework and data capture and synthesis as we move along in an evaluation. And finally, the importance of discordance. So we did start the morning talking about the different trade-offs and ended on this question of how do you balance the interpretation. Tomorrow, just to get everyone fired up, we'll complete some of the steps in the evaluation process by talking about how do we disseminate results that we have in our evaluations. We're also going to do some more concurrent session approaches, which will not be webcast, I believe. Is that correct, Kimberly? Some will be webcast. Okay, so the concurrent sessions that will be held in this room, and you can refer to the agenda to check those, will in fact be webcast. So those of you who are out there in the virtual world, we hope to have you continue to be engaged tomorrow. You'll have your bring your evaluation problem session that we'll do in some of those sessions as well. And we'll have kind of that fun sample evaluation creation of a hypothetical global health program amongst other exercises. So have a great evening, everyone. We hope to see you tomorrow morning, 8:30 a.m. GMT London time. And thank you for your engagement.